Before you spend another $30 or $40 on a blood pressure support supplement, look in the tea section of your supermarket. A $2 bag of deep red dried flowers has been studied in people with mildly elevated blood pressure. In one clinical trial, drinking the tea regularly produced a meaningful reduction in the top blood pressure number. The herb is hibiscus. It is inexpensive, naturally caffeine-free, and remarkably simple to prepare. But it is not a replacement for prescribed medication. To use it safely, you need to understand what it may do and when it could lower your pressure too much. High blood pressure is frustrating because you often cannot feel it. There may be no pain, no obvious warning, just two numbers on a screen and the knowledge that uncontrolled pressure can gradually damage the heart, brain, kidneys, and blood vessels. So when an advertisement promises natural blood pressure support, it is easy to listen. The bottle may contain garlic, beetroot, magnesium, hawthorn, potassium, or several herbs mixed together. Each product sounds scientific, but supplement marketing often moves faster than reliable evidence. Some formulas are expensive, some duplicate nutrients you already consume, and some may interact with blood pressure medicine, blood thinners, diabetes treatments, or heart medications. Natural does not automatically mean harmless, and expensive does not automatically mean effective. Welcome to Apex Ledger, where we examine affordable health habits with calm evidence rather than exaggerated promises. Today's herb has been consumed as a traditional drink in many parts of the world. Modern researchers are now examining what it may do inside the blood vessels. The herb is Hibiscus sabdarifa, often sold as dried hibiscus, roselle, sour tea, or hibiscus tea. The drink has a deep red color and a tart flavor similar to cranberry. That color comes partly from plant compounds called anthocyanins. Hibiscus also contains other polyphenols and organic acids. Researchers believe these compounds may influence blood pressure through several pathways. To understand this, imagine your arteries as flexible garden hoses. When the walls of the hose are relaxed and open, water moves through with less resistance. When the hose becomes narrow or stiff, pressure rises. Hibiscus may help support signals that allow blood vessels to relax slightly. Researchers have also studied whether hibiscus compounds influence an enzyme involved in controlling blood vessel tension. This enzyme is called angiotensin converting enzyme, or ACE. You do not need to remember the name. Think of it as part of a system that can tell blood vessels to tighten. Some laboratory and animal research suggests hibiscus may gently influence this system. It may also have a mild diuretic effect, helping the body release a little more sodium and water. But this effect is not predictable enough to replace a prescribed diuretic. The most useful human evidence comes from clinical trials. In one randomized study, adults with prehypertension or mild hypertension drank 3 8-ounce cups of hibiscus tea every day for 6 weeks. Their systolic pressure, the upper number, fell by a little more than 7 points on average. The placebo group experienced a much smaller change. People who began with higher readings appeared to experience the greatest reduction. Other trials and research reviews have also found possible reductions in systolic and diastolic pressure. But the studies were generally small and relatively short. They used different hibiscus preparations, doses, and comparison treatments. That makes it difficult to promise one exact result for every person. A 7-point reduction can be meaningful at a population level, but your response may be smaller, larger, or non-existent. And one good reading after a cup of tea proves very little. Blood pressure changes naturally during the day. It can rise because of stress, pain, caffeine, exercise, a full bladder, poor sleep, or even talking during the measurement. That is why hibiscus should be evaluated with a series of correctly measured readings, not with a single number. The most accurate conclusion is this: hibiscus tea may provide a modest additional benefit for some adults with mildly elevated blood pressure. It is not proven to prevent heart attacks or strokes by itself. It cannot replace exercise, lower sodium intake, weight management, medical assessment, or prescribed treatment, and it should never be used to self-treat dangerously high blood pressure. Here is a cautious way to try it. First, check the label. Choose plain, dried Hibiscus sabdarifa or an unsweetened hibiscus tea bag. Avoid blends containing licorice root. Licorice can raise blood pressure in some people, the exact opposite of what you are trying to achieve. To prepare 1 cup, place 1 tea bag, or approximately 1 to 2 teaspoons of dried hibiscus into a cup. Add 8 ounces, or about 240 milliliters, of hot water. Cover the cup and steep for 5 to 10 minutes. Then remove the tea bag or strain the flowers. Drink it warm or allow it to cool. Do not load it with sugar. Sweetened hibiscus drinks can contain enough added sugar to undermine the metabolic benefits you are seeking. If the flavor is too tart, dilute it with more water. You may also add a small squeeze of lemon or a little cinnamon. Do not mix it with grapefruit unless your pharmacist has confirmed that grapefruit is safe with your medications. Begin with 1 cup per day, preferably with breakfast or lunch. The research trial used 3 cups per day, but that does not mean every older adult should immediately copy that amount. After 60, blood pressure medicines, kidney function, hydration, balance, and sensitivity to herbs may all change the safest dose. Use 1 cup for several days. Pay attention to dizziness, weakness, nausea, stomach discomfort, or feeling lightheaded when you stand. If you tolerate it and your doctor or pharmacist approves, you may consider a 2nd cup earlier in the day. There is no need to drink large quantities. More tea does not guarantee a better result. It may simply increase the chance of low blood pressure, stomach upset, or nighttime bathroom visits. Now, measure your blood pressure correctly. Use a validated automatic monitor with an upper arm cuff. Do not measure immediately after exercise, smoking, or drinking caffeine. Empty your bladder first. Sit quietly for 5 minutes. Keep your back supported, your feet flat on the floor, and your legs uncrossed. Rest your bare arm at heart level. Do not talk during the measurement. Take 2 readings, at least 1 minute apart, and write down the average. Measure at approximately the same time each day. For a useful record, take readings in the morning and evening for 7 days. Do not repeatedly check every few minutes. That can increase anxiety and produce confusing results. Do not change several things at once. If you begin hibiscus tea, a new supplement, a low-salt diet, and a new exercise program on the same day, you will not know which change affected your readings. Continue the habits with the strongest evidence. Reduce excess sodium, especially from packaged foods, processed meats, sauces, and restaurant meals. Eat more vegetables, fruit, beans, and minimally processed foods when medically appropriate. Walk regularly and perform strength exercise according to your ability. Take prescribed medication exactly as directed. Hibiscus is one possible supporting instrument. It is not the entire orchestra. Always consult your doctor or pharmacist before changing your routine, especially if you already take blood pressure medicine, diuretics, diabetes medication, or several prescriptions. Hibiscus may add to the effect of blood pressure medication and cause dizziness or pressure that is too low. Do not stop, reduce, or skip prescribed medicine because your readings improve. That improvement may mean the medicine is working. If your reading is higher than 180 over 120, wait at least 1 minute and measure again. If it remains that high and you have chest pain, shortness of breath, weakness, numbness, confusion, vision changes, or difficulty speaking, contact emergency services immediately. Do not make tea. Do not wait for the number to fall on its own. And remember that repeated readings around 130 over 80 or higher deserve a conversation with your healthcare professional, particularly if you have diabetes, kidney disease, heart disease, or a previous stroke. The lesson is not that a $2 herb replaces medical treatment. It is that plain hibiscus tea may offer more useful evidence than many costly blood pressure support capsules. Have you ever tried hibiscus tea? Did you enjoy the tart flavor? And did you track your blood pressure while drinking it? Share your experience in the comments below. For more calm, affordable, science-based health guidance for adults over 50, consider liking this video and subscribing to Apex Ledger. The safest natural remedy is not the one with the strongest promise. It is the one used carefully, measured honestly, and discussed with the right professional.